So figures as soon as I hit record, Izzy, my younger dog, is now sitting here staring at me, wanting to be entertained. Unfortunately, Miss Izzy, it is podcast time. I wanted to talk about pain in general and talk a little bit about how, I've been working with bodies for like over 16 years, and have experienced obviously quite a few setbacks myself. But it's so interesting to me, like talking, especially to like other practitioners and maybe other practitioners who haven't experienced pain themselves. And I'm not saying that that necessarily makes them an ineffective practitioner, but I do think my experience with pain and my experience with physical setbacks has absolutely shaped how I work with people. And I do think people sometimes expect me to have less of a threshold for people experiencing pain that might not be deemed as dramatic as some of the pain that I've experienced. But I think it's actually the opposite. Like, yes, don't get me wrong. Once in a while, there's a moment of suck it up or try harder, as some of my questions are familiar with. But most of the time, I think it gives me a different perspective of everyone's pain scale is different. And it takes a little bit, even in like my experience as a patient in the hospital, getting like having to advocate for myself. The doctors who have taken the time to get to know me know that if I'm saying I'm in pain, there's a really good chance someone else would be flat on the floor if they were experiencing what I consider having to be bad enough to actually say something. And that I'm not, again, not also saying that's a good thing. That has a lot to do with years of me being able to disassociate from my body and being able to put that pain out of sight, out of mind. And I'm getting better at being able to acknowledge my body when it's whispering versus when it's screaming. Izzy's literally having a field day behind my computer right now. Super distracting. But what kind of sparked me wanting to talk about this is I've had quite a few people recently who have started coming in to see me in studio for sessions because of pain. And we talk through, where their pain is, what causes pain, what makes it feel better, when is it worse? Have you done anything that has offered you any sort of relief? Like we go through a deep dive trying to understand what that pain is. Is it worse in the morning? Is it worse in the evening? And then based off of where they experience that pain, we work through a program and I go through, I'm like, okay, so in theory, on paper, this, and this should work. Let's try it. Does it help? Does it not help? Let's try this for a little bit. And a lot of the time people coming in will ask if they should go get imaging done, either X-ray, MRI, whatever. And as someone like as a movement specialist in my facility, first of all, legally, I cannot be telling you yes or no for imaging. It is always a good idea to know what you're working with, but a lot of the time, what ends up happening is it doesn't change my treatment program because I'm still basing off of your symptoms and how you're telling me you're feeling, not what the X-ray shows. So I had one client who had extreme hip discomfort. They had gone to a couple different practitioners. We had tried a couple of things, treating symptoms, treating it with information they had given me. And we weren't making any progress like whatsoever. It wasn't better, worse, or the same. It was just there. So I did send them to go get imaging done. And it turns out they had a pretty gnarly labrum tear in their hip. So that's different. That's not something I, with soft tissue, can manipulate. And that needs to be in their circumstance that was surgically repaired. And then they came back and we did the rehab. But on the flip side, I had another client, again, hip pain, hips are just the theme right now. But I had another client with extreme hip pain, again, on their scale, whether or not it's the same hip discomfort the person with the labrum tear was experiencing, I don't know. But extreme pain affecting their day-to-day movements. They came in, we started doing a program. They were seeing some success, but not quite as rapidly as we were hoping. So they did go and get imaging done. And to the imaging results, nothing was wrong with their hip. So they felt very discouraged, that nothing was wrong. So it's just an example of I think, and with the person who nothing was wrong on their x-ray, we did continue. I then had permission, because there was nothing necessarily wrong on the x-ray. I had permission then to start to push a little bit more, because if I don't know what's happening, then I don't want to mess up something. Like, again, labrum tear, like none of the things we were doing necessarily would have made it worse because of the symptoms I was treating, but probably should have like eased off on some of the things that we had done. And I didn't want to push further until we had that imaging. But the person who came back with a clear image, that gives us a little bit of permission to, okay, let's see if we can push past that discomfort a little bit more, see if we can get over that hump. And with that client, we are making good progress. And with that permission to push a little further and to deep dive a bit more into heavier weights or bigger range of motion, knowing that we're not going to be making an issue worse. But that also doesn't mean that because her imaging came through clear and clean, that she wasn't in pain. And that's where I think myself as a practitioner and myself as a patient can get really frustrated, because essentially they looked at her imaging, told her, oh, you're fine. Well, no, she's still not fine. She's still experiencing pain. Whether or not you can see structural reason for that pain doesn't mean that it's not there. And I think this is where I always get super curious, that if there would have been a difference if she was a male patient. And I hate to say that, but unfortunately that's really true. That's true. That I have a lot of female clients whose pain doesn't get addressed as seriously, as readily as some of my male clients. And again, like the client who ended up having the labrum tear. So yes, there was something structurally wrong, but he was male. He got in really quickly and was like kind of pushed through. I was mind boggled how quickly he got in through imaging, versus the other client, female. She had to really push to get imaging done. And again, yes, there wasn't anything structurally wrong in the end, which is great, but she was in discomfort and it was affecting her day-to-day life. And I know in talking to other practitioners, like identifying pain can be super frustrating. So I know like some of us will be like on a scale of 1 to 10. And I've had clients in the past where they're like, it's a 9. I'm like, okay, if it was a 9 in my world, like there's a tag on your toe. Like your 9 is you're close to done. So that's where like my pain scale might be a little bit different. But I think at the end of the day, it just comes down to talking to the people and taking their word for what they're saying. So I hate when practitioners are like, oh, I don't think she's in as much pain as she thinks she is. I'm like, what does that even mean? To them, they are experiencing it on that level. So honor that, take it as what they're saying. And yes, my pain tolerance is honestly probably a lot higher than most of the people I work with. I would hope so. I don't know how I would have survived so long. But it doesn't mean that the way they experience the world is incorrect. So even I have clients who like have like more sensitive, just like skin tissue, and where I think I'm like lightly touching to give them a little bit of feedback, I can feel their tissues like tense and pull away from just a little bit of like, I have very weak old lady hands. And like, if I'm able to make you flinch, like something's going on there. But I think just honoring that, and not just saying you're fine. Like even with people who come back with clean images, or they've been cleared by physio or whatever it is, I need to take that step further. If it hurts, we're still going to modify. There's that huge barrier of like, what is pain versus what is discomfort. And a lot of the time, if you do have something going on with your body, you do have to push through a little bit of discomfort, but doesn't need to be pain. And especially in my world, like there's there's no excuse for anyone who's working through any sort of physical fitness program with anyone, physio, personal training, whatever. There's a million different ways to do something. There's a million different ways to get a certain muscle group targeted or to get it to activate. You do not have to stick with that one modality. And I think that's where some people, whether it's ego or what it may be, just because something sounds good on paper doesn't necessarily mean it applies to the person. And like I said, I've been doing this for a long time. So majority of the time, what works out well in my head does actually end up working well in real life. But when it doesn't, I don't get hung up on it. And that's where I think it's so important to have multiple tools in your toolkit of, okay, this line of pull isn't working. What can we do differently to still get that to activate in a more supported position, in a more secure position, whatever it may be. But just that whole notion of listening to the person from a practitioner standpoint, but then as a participant or a patient standpoint, knowing that you need to advocate for yourself, which I realize is really scary. And I mean, like I learned to do that at the age of 8, how to advocate for myself in a medical setting. And yeah, I don't get uncomfortable with that, but I completely can understand for someone who this is new for you to be experiencing pain, discomfort, concerns, whatever. I know advocating for yourself can be icky, and it's hard to challenge a medical professional. But even like if I stick in the horse world, like even just the example of with my late gelding, like Dickens ended up having laminitis, so it affected his feet. He was really sore. I had a professional tell me what we should be doing. I was out of my depth. I didn't know. So I went with their way, and their way didn't work for my horse. Maybe it works for every other horse. My horse was really special. He was like special in a loving way and then special in a not loving way at the same time. But on paper, this is what you do for the course of action to treat this. And it threw off his whole structure. It was not working well for him. He was in more pain and discomfort. And I more or less burned a bridge with that, advocating for my horse. I was told that I didn't know what I was talking about. And there is some truth to that. I did not have an experience, but I had the knowledge of knowing my horse inside and out and seeing him every day, not every 6 weeks or however often. And that gives me a right to say that I might know better in that situation for that specific case, for my specific horse. And I think the same goes for people. And I'm not saying you have to be an asshole about it, but if you don't feel like you're being heard, you do need to advocate for yourself. And if that makes you a little uncomfortable saying, I don't feel comfortable doing that, or I don't think you're hearing me, there's a lot you can do. For example, one of my favorite lines is if I'm taking a concern to a medical professional and I don't feel like they hear me, or I don't feel like they want to move forward with that issue, if you ask them to make a note in your file that you brought these concerns and no course of action was taken, A, they have to actually make a note of that. And then B, if something comes up later, not that it's an I told you so, but a little bit of like, see, this was actually an issue. Like, for example, I have hip dysplasia that I just found out about within the last year. I've had ongoing hip discomfort that turned pain. I've had discomfort for about 7 years, pain for the last 2 probably. And I wanted to do my own little experiment because I do have a fairly in-depth knowledge of how the body functions. I was getting bursitis pain on the outside of my hip, and your hip versus a pretty big socket. So I wanted to test with my family doctor if a cortisone shot helped to take away that inflammation, if that kind of solved all of my life problems. So this was me asking for a cortisone shot before we had x-rays. So she didn't know what she was treating. And I on the one hand, was really grateful that she agreed to do the cortisone shot without x-rays because of the knowledge that I have. But I was kind of like, side note, please don't do this for everyone else. Please get an x-ray first so that you know what you're doing. So I got the cortisone shot. That was life-changing. I was out of pain. Cortisone shots typically last like 6 to 8 months. So I started to feel the pain starting to come back after 6 months, but I was like, okay, confirmed, that helps. Now we should probably know what's actually going on to make that be an issue. So I had requested to get a hip x-ray done and I was denied. I was told that if the cortisone helped, why wouldn't I just continue with that? And that's where I'm like, okay, that's bullshit. If that's helping, it means there's something going on in there. I've done all the things I can do. I've been seeing physio for years. I see osteo, I see massage. I do all the things to help myself. There's something else going on in there. So I ended up having to go through my nephrology clinic, my kidney clinic, for my hip. But again, they know me so well. So they know if I'm coming in saying I'm in immense pain, that I'm in immense pain. So I ended up getting that x-ray, but I had also said it was a family doctor who was filling in for my regular family doctor while she was on mat leave. I did say, I would like you to please make a note that my request for a hip x-ray was denied. And so legally she has to put that in, that it was denied. Or I brought up concerns and they were ignored basically. So then when I got my x-ray and saw that I have like fairly moderate hip dysplasia in both hips, it was kind of like I told you so moment. So then when my regular family doctor came back from mat leave, she's just like, oh, I see that was denied. And I was like, and then did you see the results? And she's like, I did. I'm so sorry about that. Because again, it wasn't her that denied me that. But after that, it just made it like, then I have that information because like, obviously you're going to have hip discomfort if your hip isn't sitting in a desirable angle. But I had pain. I advocated for myself. It was denied. So then I found pushback and I went a different way. And so it tense leaving the doctor's office where I asked for her to please make a note that my request was denied? Yes. Do I care? No, because at the end of the day, those hip x-rays were actually quite important for determining course of action. Have I changed anything severely with that information? No, I'm still treating the symptoms. So I still have more bursitis symptoms versus a lot of the time with like hip dysplasia, it can be like groin adductor pain. And not for everyone, but often. So knowing that that's the core issue, bursitis is just kind of like a side effect of the way my hip sits in the socket. But I haven't necessarily changed my approach to my movement sessions or how I'm approaching my pain discomfort. It stayed the same, even though I just have that confirmed this is what's happening. But the approach I was taking, how I was attempting to treat my symptoms, that still stays the same. And yes, now like I have a surgery consultant involved, nothing happening anytime soon, but I'm sure at some point in my life, I'll end up with a hip replacement, which is not necessarily new information. Also considering I've been on prednisone since I was 8 years old for my kidney transplants. So bone health is not really in my favor, but I've been throughout my life trying to do the best that I can to make sure my body has strength and support through those moments. And I also do find like it's always interesting talking to people in terms, like even people talking about advocating for their horse. I know that's hard to go against professionals, but there's also always more than one professional out there too. And like even for myself, if someone has been with me for a little bit and they try something else and they find either more results, more joy, if they like doing it better, I do not take it personally if people jump ship and don't come back because they weren't meant to be a forever client. I've had some clients that have been with me for 13 years and I'm like this a long time, but I'm so grateful and I'm so glad that after 13 years, I can still come up with things that make them feel good and make them feel like they're having fun while they're moving. But as a practitioner, and like I know talking to all the good practitioners out there who I do respect, they all feel the same way. If you find someone else out there who can give you what you need, that's great. We're very happy for you. And like for me personally, I'm a little over max capacity in my practice. All the people that I really respect are at max capacity with a wait list a mile long. And when you're good, you should, first of all, but also know like it's okay as a client, it's okay as a participant to, like, even if you go to someone else in the same clinic, if that practitioner takes offense to watching you go to someone else, they are not the right practitioner for you. We should all be just wanting what's best for everyone in whatever way they need. But there's my little pain spiel. And again, once in a while, you need to work through discomfort. But I think as a practitioner, having compassion for, like, yes, my hip discomfort is fairly large. My pain tolerance is obnoxiously high. The shit that I've put my body through, and not even what I've put it through, but what it's been through, like, to someone else, their tennis elbow, that might be the same level of pain that I would consider my hip. And to them, it's real. And I think that that's the only thing that really matters at the end of the day, is to the person who is experiencing it, that is their reality. And just having a little bit of compassion towards that, so that you're not making them feel like crap for voicing their opinion. It needs to be a safe enough space and practice that they can voice that and know that that's going to be heard in humans and in horses. Even like my mare yesterday, I know I've ranted a little bit about people saying like, oh, she's just being a mare. But yesterday she was stiff coming in. The weather's been all over the place here in London, Ontario. We got like 4 feet of snow at the barn last week, and then it all melted, and now it's ice and it's damp and it's awful. And my mare is 20, and I forget that because she doesn't often act like she's 20, but she is older and she is going to feel that. I'm like 99% sure she probably has arthritis in her left shoulder. So yesterday I just did a really slow heating pad on, really slow groom. After the last podcast with Steffi, I'm really have made an effort to slow things down even more with her. Even like I thought I was kind of checking myself when I would go into the paddock to go get her, but she would run away from me. Run is a strong word. She would intelligently just take a few steps away from me so I couldn't get to her. So yesterday when I went out, I tried, before I even opened the gate, to just really, truly take a moment. I took a couple of deep breaths before I even opened the gate, stepped in, took a couple of deep breaths there, didn't immediately like beeline to her, because even though I think I'm checking my energy, I think I would still come in like, okay, I'm going to go get the horse, and then we'll come in, I'm going to do this. And I just really took a conscious effort to slow everything down and not rush over to her. And like part of it is I'm just so freaking excited to go see her. But she's forced me to check my energy and to realize that even though I think I'm coming in cool, calm, and collected, I'm not. Because yesterday I really slowed it down. I still haven't necessarily got to the point where she comes to me yet, but I would like take a couple of steps, pause, breathe, not even make an effort to like touch her shoulder or anything, slowly go forward, pause, breathe. And then I was very easily able to just slip her halter on. And then I took my time letting her, not like lollygag, but like I didn't drag her to the barn. I tried to walk at the pace that she was comfortable with. And it really made, like, it just was so much nicer. And it was so much nicer for me to realize that even though I don't think I'm rushing, I'm still rushing. And to just slow it down for her and for me, it felt much nicer. But then I brought her in, put the heating pad on, really took my time grooming, took time to note, like you don't have to guess what she's thinking. She's very vocal, not like with her facial expressions. She's quick to tell you exactly what she's thinking. But Steffi had also like mentioned, she like Cashew can have some moments of girthiness. So I just like held my hand where the girth would go and just took a couple of really nice deep breaths. And she like big breaths, licks and chews, like, oh, that's so much better. And then I just super slowly tacked her up. And it was like, I never rushed tacking up anyways. I'm really, really gentle and really slow with the girth to begin with, but like I really slowed that down. And not even necessarily with my movements, because I think my movements always mirror going slow, but with my energy, I tried to really drop that down. And that made a world of a difference. But I did a couple of laps, just walking beside her. She was really slow. And then I got on and I could just really feel she was stiff. And I hadn't been out the day before. And the weather's been so crappy. So it's not like she's really moving by herself. So we just did a really low key session. Lots and lots of walking, lots of trying to like get some bending, some backing up. And she a couple of times was like, nope, that doesn't feel good. And I heard that, and instead of saying like, oh, well, we're just going to do this anyways, I modified our session. I think I only rode for like 20 minutes, and mainly just walk. I tried a little trot just to kind of see if she was coming up lame, and she wasn't lame. She was just stiff and sore and cranky, and that's fine. So today, usually I ride with friends in the evenings, but I just go out and see how she goes, and if she's still presenting with as strongly as she was feeling yesterday. I have some leftover Previcox that Dickens was on regularly, and she has osteo next week, but I'm just going to see if having a little bit of that just makes her life a little bit more enjoyable. And it's so interesting, again, I'm going to bitch about people's opinions of mares maybe forever. But I had quite a few people who are like, oh, she's fine. And like, she is, but she isn't. And if she's like at that point where like she's really letting me know that this doesn't feel good, she's going to try her best because she's a really good girl. But is that fair to ask her to do that? And I've always had a little bit of a differing opinion from a lot of people that I work with on a day-to-day basis, in terms of like, I always ask, is that fair to them? And everyone has various opinions about that. But it's not like the humans that I work with that they can tell me, yes, that hurts, and this is how it hurts, and yes, that feels a little bit better. Like, I can really pay attention to what my mare is communicating to me and take that as like, she's not lying, she's not trying to get out of work, she doesn't have the cognitive ability to do that, and just take it for face value. And if it was a human I was working with, I would never be like, oh, that really hurts your knee. Okay, do more. But you know what? Let's go faster. Let's go harder. Let's add some weight to it. It doesn't make sense. So I think and that's why I have never, I had quite a few people who are like, oh, you ended up with another senior mare. I don't mind. I'm a lovely home for seniors, for senior horses. I don't mind throwing the heating pad on. I don't mind giving up a day that I planned to ride, because that's not what is best for them. And I don't mind taking that time to hear her and listen to her. Probably more so than I do some humans. Kidding, not kidding, but just being mindful of, and I think the bottom line is, it sounds so cheesy, but just showing up with a little bit of compassion for whether you're a practitioner or the people in your life, having some compassion for yourself if you're a human experiencing something, and then having compassion for your horse. That would solve a lot of problems. Just showing up in a compassionate way, slowing things down, and just taking what people say as face value and going from there.